Welcome to IPAT. So we're just going to get right into the agenda. The first speaker that we have is the Dialsmith report. It's a COVID-19 communications research results. And our presenter is Gina Derrickson, who's the VP of Research and Consulting at Aboutillian Labs and a 20-year veteran of the qualitative research where she's worked to develop and refine product sales and messaging for companies like Amazon, Salesforce, Johnson & Johnson, Procter & Gamble. Gina is going to be presenting the findings from a recently completed study on COVID-19 vaccine messaging that they partnered with Boost Oregon on. Gina, go ahead.
So I want to share with you today a project that we recently conducted on COVID-19 vaccine messaging, how to break through to a few different populations of interest. So a little bit about Aboutillian Labs. We're a boutique strategic messaging qualitative research firm. A little bit about the research that we did. We did partner with our sister technology service firm, Dialsmith and Boost Oregon as advisory partners. And we conducted an online study. Our goal was to offer research-based recommendations to optimize Boost Oregon's efforts in communicating accurate information about the COVID-19 vaccine to targeted populations that might be hesitant or resistant to taking the vaccine. So let me tell you about what we did.
We fielded a national online survey
in late January through early February with
we
200
focused
adults.
On those people that are
we
ages
focused
40
on
to
ages
64
of 40 to 64
because we wanted them to have
a moderate risk of
getting COVID-19
having difficulties
and also
from
we wanted them to
COVID-19
be
and also to be
round
a little bit
people
earlier
that would
in the
qualify for the
qualification
vaccine.
process to
We did a
receive
mix
the
of
vaccine.
Caucasians and African Americans.
We broke
so that
out
we could test some
half
of those early
Caucasian and half
hypotheses that we
African
had.
American,
And
we
we
had
made sure that we
hypotheses
screened
that
for people
the
that either
African
had a low
American
to moderate
population would
willingness
have
to receive
more
the vaccine when it
hesitancy
would be
about
available
taking
to
the
them.
vaccine. And we
So
also
we
focused on those
tested
that
2
weren't
audio
immediately
recordings
ready to take the
that
vaccine
were
when it was
of messages
available.
with 2 different
In
approaches
addition to this online
about
survey,
the
we also
COVID-19
dial
vaccine.
tested
And we
2
also followed
messages
up
that we
with
created.
6 in-depth
It offered
interviews with
2
African American
separate
survey
approaches to
respondents
how you
to
could
further
communicate
dig
information
into their
about the
perceptions of the
vaccine. And
vaccine
I also
and how we
conducted
might
6
be more
in-depth
effective in
interviews
influencing
with,
them.
we analyzed with a couple key breakouts. The first was attitudinal based with regards to people's willingness to take the COVID-19 vaccine. And we broke them out into either being the opposition or persuadables. And we also analyzed them according to race, the Caucasian versus African American breakouts.
So what we did is early on, we identified groups as either being persuadables or the opposition. And we used one key question to do this. We asked, how likely are you to receive the COVID-19 vaccine when it is available to you? They responded on a 0 to 10 scale. A 0 meant they were not at all likely to take it. And a 10 was they were extremely likely to take it. We focused on those persuadables and opposition categories. Persuadables were those people who responded a 4, 5, 6, or 7 with a moderate likelihood to get vaccinated. And they were about half of our respondents. The other half, we called the opposition. They were the ones that rated a 0, 1, 2, or 3 as far as likelihood to get vaccinated. And it's interesting that the average score for them was a 0.9. So even though they may have answered a 0 to 3, there were a lot of zeros, a lot of ones in there. So really, really strong opposition to getting vaccinated.
Another key question that we asked is, how long do you expect you will wait after the vaccine is available to you? And I think it's important just to add a little bit more color to who this opposition group is. 86% of them said that they would wait 1 year or more. So, in our eyes, waiting a year to take a vaccine for a pandemic that's going on now is a really strong signal that they're likely not going to take it at all. So let's look into who are these persuadables and who is the opposition a bit deeper. How have they responded to COVID-19? The persuadables are more concerned about getting COVID in general, with 42% of them in the high concern range versus 23% for the opposition. And they've also been more compliant with practicing safe measures. In our survey, we asked a lot of different questions, but I'll just point out one of these. And this was in the context of how you're interacting with close friends and family, not in your immediate household. So kind of not in public places where masks and things tend to be mandated, but where it was on more of their own thoughts. But 31% the opposition say they never wear masks when they're near friends and family not in their household, compared to 14% of the Persuadables. And then you might be thinking, oh, I know some of those people that are in the opposition group. Well, you would probably hear them saying things like they said in the survey. They say things like, it is a free country and peer pressure is unacceptable. Or they say, I believe some of the information is overplayed to scare people. We also looked at who are they politically. Persuadables, you might not be surprised to see that they skew more liberal. Opposition skews to be more conservative. And who do they trust? We had them rank 12 different sources of information that could provide information about COVID-19, and they ranked them from 1 to 12. And we focused on their top 4. So among the Persuadables and the opposition, you see personal and local healthcare providers in their top 4. But rounding it out for Persuadables, you see CDC officials and you see global public health officials. Compare that to the opposition, where you see close friends and family as their number 3 information source that's trusted. And you also see nonprofit organizations. And CDC officials are like number 6 or 7 on the list, so quite a bit lower. Calling out a quote from the opposition, they even said there will be fatal side effects that will be covered up by the pharmaceutical companies that made these vaccines. Kind of gives you an idea of how they're thinking about who they trust. Persuadables are more aligned with preventive medicine. One opposition actually said, I don't trust vaccines. 2 of my grandsons have autism due to vaccines. And you see that 18% of the opposition actually disagree that all children should be vaccinated against common childhood diseases. Persuadables are also more likely to have regular healthcare professional visits. 31% of the opposition disagrees that they regularly schedule visits. And one opposition person said, I've never had a flu shot and I'm not about to start getting one now. So next we looked at how these segments respond to messaging. And at the bottom of the screen, you'll see a slider dial. And you may be familiar with the dial focus groups that CNN has after a presidential debate or a message from the president, where CNN will have focus group participants evaluate the messages they hear it and then do a focus group. Well, that's our Dialsmith technology at work there. And we can also use that technology online. So what we did is we created 2 different messages that were about 4 minutes long. One we called the science approach, and it gave a lot of technical information. It talked about how the vaccine works, how the vaccine was able to be approved quicker than other medicines, and also other technical questions were answered in that approach. Compare that to the other message, which we call the loving approach, that really focused on the moral obligation of people to take the vaccine to protect others in the community, maybe the elderly, maybe other people that are more vulnerable to COVID-19. And we're going to play just a short snippet of each of these approaches so you can get a feel for the tone of them.
This vaccine technology has been around for several years now. Because COVID-19 is similar to the SARS and MERS viruses, much of the research and clinical trials performed on SARS and MERS vaccines could be reapplied to COVID-19.
That was the science approach, and now we'll play the loving approach.
Our elders are one group at a significantly higher risk for dying from COVID-19 and complications. These are the people who helped create the economy that we all prosper from. They are parents, grandparents, and special friends to people who care about them so much.
Okay, so let's look at what worked and didn't work in the science approach. And I'm showing you here the output. So as people are evaluating the message they hear, second by second, we are obtaining their average liking score for how well they like the message. So over time, we can see what they're listening to and how they're responding. And we use that as a way to diagnose things that are effective or not effective in the message. So the first thing we note here is the Persuadables blue line versus the opposition kind of lime line is pretty different. There's a good solid 20-point spread between them. Everybody starts out at 50 on a 0 to 100 scale, which is your neutral point. So in an effective message, we expect there to be a lift, and we're looking for things in the 70s that are a strong message. So really you're seeing that Persuadables are on board, they're hearing information that they appreciate, and there's not a lot of fluctuation in their score. Compare that to the opposition, which is quite a bit lower. They're at 50 or slightly below 50, pretty much for most of the message. And in the early beginning, that first red circle points out to the very first time we speak the word vaccine, talking about the need for you and your family to be vaccinated, you see that dip. So that's a trouble spot for them already. And then of interest, it starts going up for them a little bit to their highest points, because we're talking about how important it is for people to get more information about the risks and the benefits of getting the vaccine. So they were on board a little bit for that part, but pretty much flat and under 50 for the rest. And then at the end, that red circle denotes a quote that we had from Dr. Fauci, which he was very reassuring. He talked about, we do know that the vaccine is safe and can prevent severe disease. So that was kind of a high point for the Persuadables. Other things the Persuadables said about this science message: it seems to address the fears of many who are a little hesitant to take the vaccine, like myself. It was detailed and informative without being condescending. So it was working for the Persuadables. Let's look at the loving approach then. So here we see, again, the scores for the dials are pretty similar. Persuadables are much higher than the opposition. And I'll just point out two interesting points here. The first red circle, the verbiage that was spoken was, even beyond the health impacts, others are suffering ill effects in terms of financial health and mental wellness. So for the opposition, that was a statement that they could latch onto. They showed a little bit more interest in that. And we believe it represents some common ground in speaking to them. Perhaps they were hoping to get more information about that, but I think that's a good starting point of how to talk to them about COVID-19 and the vaccine. And then look at the big red circle at the end of the line. We actually had a quote from Dr. Frederick. He is a surgeon at Howard University. So he stated that he had sickle cell disease. He's a surgeon. He was one of the first people to take the vaccine. And he said, however, we can't get to the other side of this pandemic without you. And it's important to note that both of these groups actually resonated with that message pretty well. So that was strong. Other things Persuadables said about the loving approach: it reminds us that we're all in this together. A man with sickle cell was one of the first to get the vaccine. That's leading by example.
So what do you need to know about Persuadables? Why do they say they'll wait? There are a couple different reasons. In their words, there's not enough facts and information on the effectiveness or side effects. They want to wait and see how it affects others. They're waiting until people who are older or more vulnerable with health problems to get it first. And some are waiting until their physician says they should because they have a pre-existing condition or other health condition that they're concerned about. But the good news for our study was both of our messaging approaches were effective. In fact, 42% of those Persuadables actually moved to on board. So a higher willingness to take the vaccine in the 8, 9, or 10 range after they heard one or both of our messages. So what do you need to know about the opposition? Their opposition is strong. First, you need to cover a couple bases with them. You need to convince them that the threat of COVID-19 is real. You need to move them to a compliance mindset for the benefit of the whole community. You need to get them on board with vaccines in general and convince them of their safety. And then you need to build a connection with a trusted source. Once you've covered those areas, then you can start messaging to the opposition about COVID-19 vaccines.
Let's look at our second analysis, and that was by race. So what we saw when we looked at Caucasian versus African American in our survey is that African American tends to skew a bit more persuadable than Caucasian. And that's something that we were surprised about. Otherwise, their differences are fairly minimal. African American was slightly more concerned about getting COVID-19. And that's likely tied to a higher percent of personal connection to someone impacted by COVID-19. Here you see the majority of them personally know someone who has been diagnosed with COVID, and that's quite a bit higher than Caucasian. And also more than a third of them actually know someone who's been hospitalized with COVID-19. So let's look at how these two groups responded to the messages. On this slide, we show the Persuadables versus the opposition, just as a reminder of how big that gap was. Looking at Caucasian versus African American on top, though, you'll see that their differences were much smaller. And, you know, the shape of their lines are pretty darn similar. That was for the loving approach. You might wonder, well, how did they do for the science approach? Again, the lines were very close to each other. So really the messages are working much more similarly for these two groups.
So what do you need to know about the African American group? First, they have a more personal connection to COVID-19, which leads to them being slightly more concerned about getting the virus, and they've been slightly more compliant with precautions along the way. They tend to skew more to Persuadables compared to their Caucasian counterparts, and they actually gave both of our messages a slightly higher rating than the Caucasian group.
So closing up, I want to talk about those in-depth interviews that I conducted with 6 of the African American survey respondents. And the purpose of this was to get a little bit more insight into their dial responses, and also just to learn more about their attitudes, their experiences, their values, that kind of form their perceptions and opinions about taking the vaccine.
From my in-depth interviews, I want to share 4 key takeaways that I found to be really interesting. First, they have a lot of questions. Most of them stem from, will it work for me? They're really seeking that reassurance on the effectiveness and side effects that it will have for them as individuals. They're seeking a reassurance from 2 different types of sources. First, the scientists and the medical community, they're very interested in hearing about the people who created the vaccine, how it was tested, people that were involved in the testing and the approval process. Plus, it's really important that they hear from people that they personally know that have taken the vaccine already, and not just the day after they take the vaccine. They want to hear from them after a few weeks have passed. They really want to know that they're okay and that it was worth it for them to take the vaccine. Some feel that they can control the prevention of contracting COVID-19 better than they can control the possibility of getting serious side effects from the vaccine. They talk to me about all of the things they've been doing, avoiding crowds, staying at home a lot, washing their hands, wearing masks, social distancing. They've been doing a lot, and they've been successful so far at avoiding COVID-19. So for them, it feels a little bit contradictory to say, okay, now I'm going to take the vaccine into my body and subject myself to having side effects. So they just need to think about that control over their bodies and their health a little bit differently. They blend COVID-19 and the vaccine and those side effects a lot, and sometimes they have a hard time differentiating between the two. Finally, all 6 people I talked to were flu shot avoiders for multiple reasons, but it all boils down to they sense that flu shots are safer than the COVID-19 vaccine simply because flu shots have been around for so much longer, but they still are not on board with taking the flu shot. So it's an even stronger argument that they need for the COVID-19 vaccine. So I also identified some
breakthrough
opportunities.
The first is to frame the vaccine as a way to stay
One thing
in
that
control
I'd like to try out is framing the vaccine as a way to stay in control as compared to COVID that they can't control.
I think it's also an opportunity to compare the uncertainty of long-term COVID symptoms to long-term side effects of the vaccine.
I'd also like to see messaging that
for
compares
example,
the
one data point
uncertainty
here
of
is
long-term
there are
COVID
more than
symptoms
twice the number of
to the
people
long-term
now
side
that have
effects of
received
the
the vaccine than
now
have
we have
had
twice as
COVID.
many people
So
that have
we should be
received the
able to say
vaccine
we know
that
a
have
lot
had
more
COVID.
about
So we
side
have a lot
effects
more
and
information about the
the
vaccine side
probability of
effects.
people
And I
getting
think we
side
need to
effects
bring
from the
that
vaccines
to the
and actually
attention of
COVID.
people
And I think
that
that
are
would be
hesitant to
reassuring
commit.
to them.
We also need to bring
Number
to life
3 is to
the
bring to life
diversity
the
of the people in
diversity
the
of people
clinical
in the clinical
trials, help them see
help them
themselves
to
and
see
know that they were
themselves,
represented
whether it
in the
be their
clinical
color and
trials,
ethnicity
and
or their
that their
age
side
or health
effects
conditions
should be
or
similar
concerns
to
that they
those
have.
people in the
They
clinical
want to
trials.
know that
And when
people
I
like
say see
them
themselves
were
in diversity, I
represented in the
mean see
clinical
their race
trials.
and ethnicity, see
And
their
finally,
age,
to share
see their
stories of
gender,
people weeks after
see
their
people with
final
health
vaccine
conditions like
to,
theirs. It
first
is
of
so
all,
easy
show
for
that
them
they're
to go
okay
down the
after
path
taking
of
the
Murphy's Law
vaccine,
and
but
say,
second of
but
all, and even
I'm
more
going to be the
importantly, to
exclusion
show their
because
positive
I wasn't
outlook
included in the
and how
test.
they feel more
You need to
confident
really know
being
that
out
that
now
clinical
they're
trial
vaccinated,
represents
how they can
all of
spend time
us.
with their grandchildren, do things like that.
Finally, I think it would be really effective to share stories of people weeks after their final vaccine to highlight their positive outlook. There are two different things you need to demonstrate, and one is that they're okay, they've overcome the side effects, and they have a healthy outcome post-vaccine. And the other one is just emotionally and socially, those things that they can do. Show the grandparents spending time with grandkids, show, kids back in school with teachers, show people enjoying company together. That whole, help them see that end of the pandemic coming because people are getting vaccinated.
That was great. These findings that Gina presented to this group here today, which we found incredibly useful at Boost Oregon when we received the results several weeks ago. And that's why we wanted to bring it to IPAT, because I thought so many of you could benefit from this information as well. We've been taking into consideration the findings and the suggested messages and using them to shape our own messages in a variety of COVID-19 educational efforts that we're creating.
I'll open it up to questions if we have time for that, but I will also offer, if anybody wants to reach out to me, we can make the slides available. We actually have a full report that we can make available too, and I'm happy to connect with anybody if you'd like to discuss any of the ideas I shared.